Breakthrough prostate cancer treatment uses ultrasound waves to eliminate tumors. Elias Marat, The Minds Unleashed, reports this. The new method is being hailed as a promising alternative to treatments involving surgery and radiation. Okay, ultrasound waves, amazing. Doctors have made a tremendous step forward in the fight against prostate cancer using targeted ultrasound pulses to successfully eliminate the disease entirely in 65% of the cases with few side effects. The new method, detailed in a study presented at the annual meeting of the Radiology Society of North America, RSNA, could be a promising alternative to surgery. Prostate cancer is the most common cancer among men, second only to skin cancer. It's also the second leading cause of cancer deaths among men in the United States. According to the American Cancer Society, ACS, an estimated 174,650 men in the U.S. will be diagnosed with prostate cancer in 2019 alone. Traditional treatments involving surgery and radiation have proven challenging due to their life-altering effects, namely leaving subject impotent, incontinent, or with bowel dysfunctions. An estimated 3 million survivors of prostate cancer are alive in the U.S. today. Yet the revolutionary new technique avoids such risks by relying on a rod-shaped device that is inserted into the urethra and uses magnetic resonance, or MRI, to focus precise ultrasound pulses on tumors, heating and destroying them while leaving the surrounding areas entirely unharmed. The minimally invasive method, called MRI-guided transurethral ultrasound ablation, or TULSA for short, was used on 115 men who suffered localized prostate cancer. According to researchers, in 80% of the cases, most signs of cancer were eliminated, 80%, while all signs were gone in 65% of the cases after 1 year. No bowel complications were reported overall, while most men saw their blood antigen markers for prostate cancer reduced. Stephen Raman, co-author of the study and professor of radiology and urology, University of California, Los Angeles, UCLA, explained, it's an outpatient procedure with minimal recovery time. We saw very good results in the patients with a dramatic reduction of over 90% in prostate volume and low rates of impotence with almost no incontinence. There are two very unique things about the system. First, you can control with much more finesse where you're going to treat, preserving continence and sexual function. Second, you can do this for both diffuse and localized prostate cancer and benign diseases, including benign hyperplasia, he said. TULSA the method has already been approved for clinical use in Europe and has received the U.S. Food and Drug Administration 510K clearance for prostate tissue ablation on a nationwide level. The researchers hope that follow-up studies support the initial results of clinical trials so that the technique can become an important tool in the fight against prostate cancer and other prostate ailments. Okay, so this is now in effect. It has received clearance from the Food and Drug Administration for treatment use. That's wonderful. This is on The Mind Unleashed. If you'd like to join me on my Patreon account, you will hear content not covered by mainstream media. These riveting stories will be based on my research, and I will state my opinions and give my personal insight on diverse and controversial subjects and world events not covered by mainstream media, and not supported by YouTube guidelines. So whatever I have on my Patreon, most of those will not be on my YouTube channel. Please consider becoming a member today. More of the most significant and important videos will be on my Patreon channel. Your support helps me to continue my research and keeps this YouTube channel alive. and we depend on your support, your generous charity, because we help economically challenged families here in Athens, Greece, in Kapota, and we also help the young generation with university tuition and the community around our church. Thank you.